Are we live? Wow. Good morning, everyone, wherever you are. We are currently in Makogi of Obafemi, that's in Marlborough State. And I would like to, my name is Charles Clement Abu, and we are currently at the very spot. All roads lead to Makogi, the Diwan Hotel, and we are the venue of the official launch of the Turnify solution and the Mowe Tech Community inauguration. I'd like to say pleasant morning to you once again and to welcome you. Please be patient. We are about to start shortly, so wherever you're viewing us, please be patient. We are going to begin very, very soon. So once again, I want to thank you for joining in. If you're connecting with us from online, you're very, very welcome. Thank you so, so much. And those of you right here in the hall, we are about to kick off very soon. This is going to be an epoch event. It's going to be a very, very wonderful event. So please stay with us. Don't leave just yet. Thank you. Once again, we invite you. Thank you. I'll be back with you soon. Good morning, everyone, distinguished guests, respected members of the health community, the Ogun State Tech community, innovators, entrepreneurs, ladies and gentlemen. It's a pleasure for me to welcome you all to the official launch of the Turnify solution and the inauguration of the Greater Mowe Tech Community. Please, let's put our hands together. Yes, indeed. Today is more than a product launch. Today is about solving a real human problem. Many of us, I know for myself, you have experienced issues with queuing up at banks, hospitals, in government offices. But it becomes critical when it involves human lives. When a person is sick, what they need is urgent attention. But when you have a situation where a sick person, somebody who needs urgent help, is delayed by a problem that can be solved with proper attention, with the right people, with the right tools, then it becomes a problem. That is why the theme of this program is so important. Patients should not have to gamble with their time. Today we're going to be witnessing how a startup, a company, a group of people, a team, have put together their skills, their time, their resources to provide a solution to this problem. Today we'll witness how innovation from Nigeria in Ogun State, in Marlborough, is solving problems that millions of people experience today. Without wasting much time, we're going to be kickstarting this event. Once again, I want to welcome all of you to this program. It's a very important program, and you should be glad that you're a part of this history-making event. I want to thank you for coming, and to begin this program officially, I'd like to welcome upstage Mrs. Balogo to lead us in the opening prayer. Please put your hands together for her. Please, it's important. Put your hands together for her. Yes, you're welcome.
Please let us pray. Our eternal Father, we lift up our voices to say thank you. We bless your holy name because you are the giver of life. Thank you because you are the one who gives wisdom. You are the one who leads us in all that we do. God, we want to thank you for this beautiful morning. We thank you for what you have put together, what you have put in the hearts of your people. We thank you, Lord, for this official launch. And so, Father, because you are the one who knows the end of the thing right from its beginning, we commit the entire program into your hands, and God, we pray that in it all, your name will be glorified in the name of Jesus. I want to thank you for the organizers. I want to thank you, Lord, for what you have put into them. Father, we pray that more than this you will do through them, even for this community and other communities in the name of Jesus. Our Father and our Lord, we pray for those who have been invited to this program. King of glory, we ask for Lord that your Holy Spirit will quicken them and bring them safely here today in the name of Jesus. This program shall be a success. Beyond even what the organizers have planned, Lord, we will make this program to succeed. In the name of Jesus. And at the end of the day, O Lord, we pray that you alone will take all the glory and the blessings shall be ours. Thank you, Father, because we know you have heard us and much more than we can ask for you will do for us. Because we have prayed in Jesus' mighty name.
Amen. Please, thank you so much, Ms. Malogo, for that. Please, let's put our hands together for her. And we are on. All right, we are on. We are sailing right now. So I don't know if we're actually supposed to take national anthems next. If we have that ready. In the meantime, I'd like to welcome. I'm made aware that we have tech hubs that are here present already. I know Upskill Tech is here, and I was told, is this soft link? Yes, Soft Lift is also here. Please, you're welcome. And I'm sure that more people are going to be arriving and joining us. All right? So we have a lot of things in store for us. The core meat of this event, a lot of things are coming up. We're going to be seeing and hearing from that. Do we have the national anthem ready? Is there somebody who is brave enough to lead us in the national anthem? I know the old one, but we have moved. All right. Behind every successful innovation, there's a story. All right. Please, can we come to the front? Let's come to the front. All right, so that yes, let's occupy the seats in the front. We're all one. We're all together. So behind every successful every successful story every successful innovation is a story. I beg your pardon. A story of observation, a story of persistence, a story of refusing to quit. This is how things have been built over the years. And in a short moment, we are going to welcome our host, somebody I respect very much, somebody who I've had the God-given privilege to actually sit under his leadership and learned a lot from. There are a lot of problems that human beings face every day. It takes courage, it takes bravery, it takes determination to be able to, commit your time, commit your resources against all odds to say, look, I'm going to face this problem, I'm going to solve the problem. But it takes much more when it is something that you yourself can overlook. You have the resources to make that not your problem. But when you look that in spite of your ability to overcome that problem, you take it upon yourself to say, look, I am going to solve this problem in spite of the fact that it doesn't directly affect me, but it affects other people, and these people can't do anything about it. It takes true heroism. And I would like to welcome I'm going to be welcoming a couple of people to talk to us about this. But in the meantime, please can you confirm for me if Mr. Victor would like to come up now for the keynote address? See, I confirm that. If Mr. Victor would like to come up for the keynote address now. He has asked about it. Yes. So I was saying that in a short moment, I'm going to welcome our host to talk to us about the story behind Turnify. He's going to be letting us know the journey to what we are witnessing today. Like I said, there's a story behind what is happening today. It didn't just drop off from the sky. A lot went into this, a lot of hours, a lot of grind, a lot of investment, hurdles that had to be crossed. So please bear with us, be patient. We're going to be listening to this story. And my hope, my honest hope, my sincere hope is that as we listen to these words, we don't just leave here, we have attended another event, but we leave here inspired. We leave here determined that we are going to go into our world to seek out to be problem solvers and to be part of what is happening here. The anthem ready. All right, so please can we rise up on our feet? We're going to be taking the national anthem right now. Please, let's be on our feet. Please, when I ask for that kind of thing, if you miss it, it will cause a problem. So anybody who comes, their names, so that is Mr. Victor's full doctor. Is it Yes, that was the national anthem of the Federal Republic of Nigeria. Please let's have our seats. Yes, it's an official event, it's a tech event, but please let's socialize as well. Please, before we go on to the next day, if you don't mind and if you can, please can you just greet somebody? Maybe extend a greeting, welcome somebody, find out their name, find out where they are coming from. All right, so you get to meet somebody for the first time today. All right, so yes, you're all looking so fine and ready. Please greet somebody. Tell them good morning, tell them you look good. Yes, compliment them very well. You might just be looking at the next president of the Federal Republic. All right. Oh no, not the next president. We already have one. All right, so thank you very much. So like I started out saying, behind every innovation, there's a story. And in a short moment, we're going to have the honor of listening to the mind, the person, the vision. So without further ado, and with the authority and the powers vested in me, I'd like to welcome to the stage somebody I respect very much, my senior in the industry, in the field. Please put your hands together as a welcome. Highly esteemed Dr. Victor Oluwole Ogunsanya. You're welcome. Please clap very loud, very loud. Yes.
Thank you, Mr. Charles. I really appreciate everybody for being here. What I want to be doing right now is to briefly give what I've titled "Patients Should Not Have to Gamble with Their Time." Okay, so my speech is okay. I'm gonna be opening this one up. Okay, so we saying patients do not have to gamble with their time. But before I proceed, I want to appreciate everyone here present and those who are still on their way, those who have joined us online. I want to say a big thank you for making this time. We appreciate your very busy schedule. And essentially what we'll be talking about today is how to manage and how to better manage one of the most precious resources, which is limited for everyone. So that is what we are talking about, and which is time. So for you to have taken your time to be here today, it's not something we take for granted. We say thank you. And for those who are still on their way, we say we're waiting for them, and we say thank you to them. So without further ado, I want to go into the speech. We are doing what we are doing today, not because of the software itself, but because of the potential it has in terms of the niche. Because we believe that this is not just a new software platform that we want to unveil today, but it is a movement. It is a movement to gather people who believe that what we currently have as the status quo is not just good enough. And those who refuse to believe that, those who refuse to accept the status quo, those who believe that better is possible, at least we want to have an advancement, we want to have a better service experience wherever we go. So what we have done is not just limited to healthcare, but we will be focusing on the healthcare itself, because that is the most important aspect. Every other visit, like if I want to go collect a PVC, some things can be delegated. A boss can send a PA to go and do certain things on his behalf. But if an MD of a company has to go on a routine checkup with the doctor, such tasks can never be delegated. Can it? No, it can never be delegated. He has to be there by himself. So we are not doing all of this because of the software itself, but like I said earlier, because of the movements to challenge the status quo and bring together collectively a better service experience. So before I proceed, I would like to share an experience which is personal, because without this experience, probably will not be talking about this today. This happened on the 31st of December 2024. That's the last day of the year. I had an appointment with the doctor in one of the hospitals around here, newly commissioned hospital, built to the teaching hospital standard. Very, very neat, state of the art, everything, including the hospital itself, facilities, the doctors are professional, and everything was fine. So on that day, I went. I didn't want to mix because I knew this was going to be a new experience. So I went there, making sure I didn't mix my appointment. So I got there around 12 noon, and everything went really well. The vital was taken, and I was asked to wait. So 10 minutes went into 20, 1 hour, 2 hours. I mean, patients were just being called in by their name. So when I waited for like 2 hours without knowing, there wasn't any visibility as to when it would be my turn and when I should be called in, then I became a little bit anxious. Not because I want to be anxious, because I know doctors will spend however long it will take to attend to a patient. We are not saying for our sake, doctors should probably, just rush whatever they are doing and come and attend to us. No, that's not what we are saying. Doctors will spend their time, to provide care to their patients, however long it will take. But what we are saying is that while other patients are waiting, let there be transparency, let there be visibility, such that patients who are waiting in the queue will have an idea of what is going on. If I come into the hospital and I have an idea that it will take me 4 hours before I can see a doctor, that is good enough. So as at that time, if I want to do something else, I know I have good enough time to go and deal with something else. On this this particular day, on my way to the hospital, to that hospital, I had a flat tire, which even makes it more important. So that flat tire, I could not even get it, fixed properly. I had to use the spare. So when there, why I was asking for this information was because I had to go back because that guy will close his shop. So when I couldn't get that information, I had to probably leave them anyway. I went, get the tire fixed properly. As at that time, I just have to take the decision without knowing whether they will allow me in or not. But when I came back into the hospital, I still have to wait for additional 2 hours before I could see the doctor. So at first I was angry. Then this provoked a thought in me that, is this all we can get? As I drove back home on that day, I was just pondering on this. Is this how? Because if we accept this as the norm, it is okay if it is once in a while. But when I talk to people as well, even the hospital, practitioners too, it is like a daily realities in Nigeria, and of course across the world. So it's not something that is all even limited to Nigeria. It's something that is also happening all over the world. So when we started looking at this, we just said, because the thing is not the challenge, or the issue right now is not because of the hospital itself, because the hospital, to the best of my knowledge, that hospital was excellent, a good hospital, the doctors were professional and all of that. But the real problem on that day is the problem of uncertainty, lack of transparency. Because to even worsen the whole thing, there are some people that will probably be on a different queue line, so to say. What I mean by different queue line is that, okay, if you are coming to see one doctor, there could be maybe evaluation line, there could be follow-up line, there could be some other lines. But because everybody is sitting together in the same area, in the same waiting area, somebody who even came after may be attended to before you. And since you don't have any information, you are bound to assume that, oh, it is because this person actually probably knows somebody to get him his own appointment faster. So this is the kind of thing we are looking at. We want a system that will help everybody, that will help both the patients, the hospital administrators, the care provider themselves, and everybody, so that they all can work together and have some kind of feasibility and improve patient waiting. So that is why we built Turnify. This experience I described gave birth to Turnify. We developed Turnify to humanize waiting, such that while people are waiting, it will be done with empathy. No patient should have to gamble with their time, and no person should feel invisible. Like, why is it that they are not attending to me? Why is it that, people who are coming after me people who are coming after me, why is it that they are being attended to? So that is what we are talking about here. We want a platform, we've created a platform to help the hospital administration to better manage this. So with Turnify, there are 3 ways through which a patient can join the queue. We are not going to be replaced. Turnify doesn't replace any of the existing infrastructure. If an hospital has already invested in electronic medical system, good. In fact, the more automation in place, the better. What we are doing is to fill in the gap. What Turnify does is actually to complement every existing software available out there. For hospital environment, we have people in places where EMR has been deployed. For that EMR system, what will happen is that healthcare providers such as doctors, they will have visibility as to how many patients are waiting. They will see the flow. They will know, time and like that. But that is only internal to the system. Patients don't know any much regarding what will be going on or how long it will take before it will get to their turn. So that's why we have this. The way we have designed a Turnify is such that when a patient gets to the hospital, the first thing as part of the initial check-in is to receive a ticket. So the ticket can be in form of a paper-based ticket, which can be issued from a terminal. So that ticket will have 3 pieces of information as at that time. Even giving that ticket to the patient will have his own ticket number, the ticket number. So that ticket number is important. At a point, the number will be called on the screen. So when it's called on the screen, that is the time for the patient to go and receive treatment. So the ticket number is important, and also on the ticket is the position on the queue. The ticket, once issued, it will give the exact position as at the time of issuing that ticket. So if there are 5 patients still in the queue, if there are 5 patients ahead of that particular patient, so it will be given the appropriate number that you are this number on this queue. So the patients know, have an idea of how many patients are waiting before it will get to his or her turn. Then also, we also have estimated waiting time. So as at that time, the patient already know that, okay, with these 4 people before me, it will take approximately 3 hours to get to my turn, or 4 hours, or it can be any, because every care will have an approximate time it takes to attend to one patient. So if it is 30 minutes and there are 5 patients before me, so 30 minutes, that means it's going to be 2.5 hours or thereabout. So this is what we are talking about. The patient can now decide either to stay in the waiting area or to go and do something else with their time. We are not even saying patients should leave that environment completely. It may be as simple as decongesting the waiting area. Like, okay, I don't want to stay in the waiting area. I just want to go under and catch fresh air outside under the shade. That is what we are talking about. So Turnify gives patients that kind of this is a technology that facilitates that. So with that ticket, patients can subscribe to it and be able to monitor their position from wherever they are. The other way through which patients can join, the queue is probably by scanning a QR code, which will be demonstrating all of this very soon. Can join by scanning a QR code, and that QR code becomes, gives the digital equivalent of the ticket. So on that ticket, we also have all the information I've talked about, the ticket number, the approximate position on the queue, as well as the estimated waiting time. But once a patient joins using a smart device directly like that, in addition to all this information, you will also automatically receive real-time notification when something changes. Like when we check in a new patient, you will get notification from wherever you are. The kind of notification you will get, we're going to be demonstrating that very soon as well, will include your position. So if you were number 7 on the queue before, as they check in someone in the clinic, you are now number 6. You receive that notification immediately that you are now number 6 on the queue. You are now number 5, So with that information, you will be guided accordingly, and you will know when to start making your way back to the waiting area. So that is all we are talking about. Simple, but to build a system that combines what is currently available with this gap, and have a solution that helps everybody work very well. So our vision is to build a globally trusted customer management flow, proudly developed in Nigeria and developed across Africa and the rest of the world. Before I round up this talk, I want to talk, because I've talked about this experience. So this is what we are talking about. We are talking about solution. We are talking about solution that helps, that does all of this, help patients manage their time very, very well. Help because we talk about time all the time. So that is exactly what we are doing, to make sure that time is, properly taken care of, to make sure that we manage patients. Because if we look very, very shortly, we'll be listening to another speech which will give some kind of economic cost to time that we waste in the hospital waiting area. This can be, we are just focusing on the hospital environment right now, but our vision is bigger than that. It's just that hospital is the sector that we are focusing on, but with what we have, it is something that can be, deployed in different aspects of our life. Will it be like a collection of the PVC, for example? People go and collect, because one of the problem is that the capacity of every service center is fixed. We know the capacity. If a service center can only attend to 50 people on daily basis, they don't have a way of communicating that, or restricting the number of people that should be attending that center on that particular day. So the problem is that everybody will want to go on the same day. So that is the challenge. But with Turnify, there's a way now to have an appointment book ahead of the time, so that people can know when exactly it's their turn to go and access the service. And to this, we have the solution, and we believe this is something that we can all be part of to challenge the status quo, like I said earlier on. So we want to build that branch. And I would like to recognize the team, the Turnify team, because behind everything we'll be seeing today, I need to give this to them. Today truly belongs to this team, because as a startup with limited resources, funding, and all of that, it is not easy to attract the caliber of team that will give their heart into a solution and share this vision as if So I want to recognize these special people because they have done wonderfully well. Behind all the things we'll be showing today, there are a lot of things that they have done, times and times, weekends without break and all of that. They have worked tirelessly, and please join me in appreciating these people. Turnify team, please can you stand up for recognition, please? Please help me recognize this amazing team. Thank you. So now we have the solution. As I said earlier on, we believe what we currently have, because as I said earlier, our mission today, what we are celebrating today, is not just about unveiling a new software. It is about a movement to transform how people receive care or service generally. So that is the mission. That is what we have done. So it is a software that we have unveiled, but it is now that our job has just begun. It is now the time we are calling on all our Turnify ambassadors, because the ball is now in your court. We have the solution right now. Our next point is now to get this thing rolled out into hospitals, not only to deploy, because our mission is not just about supplying software, but to ensure that this is well aligned into their process, such that it gives the benefits to which it has been designed to give. So this is something that we need to start working on to get this one into as many hospitals. And we know our ambassadors are ready, the software is ready, even the team is ready for any enhancement, any solution that probably we need to make in order to maybe modify the system. So all of this, we are ready and we are good to go. So the complexity of this solution has been such a way that we make it very easy to deploy and use. I'm not going to be talking about the software as a service, but it is very easy for any establishment to get on board without spending so much to get to use this. So finally, I would like to thank everyone that has come. And when I was giving my speech, I recognized the presence of Ogun State Tech Chairman, my president. You are welcome. Thank you very much for coming. And I also recognize everybody, members of the team. I say welcome. So finally, I thank everyone who has made this time again to be here today. So I don't want to bore you with long speech. We'll be going to the rest of the program shortly, but I leave you with this. It is not just software that we are unveiling today, but a movement to challenge the status quo. A movement to say what we are getting is less than optimal. Patients should not have to gamble with their time. Patients should not have to spend 4 hours for 40 minutes consultation. While I respect the time of those professionals, those who are giving the care or service, people who are also waiting, they are also, there are a lot of things that they can be doing with their time as well. So this is what we are challenging. We believe this is less than optimal. And if you also believe that this is less than optimal, then we are in this movement together. Thank you very much, and God bless you.
Okay.
Please, can we put our hands together once more time for our leader, our host? Dr. Victor. Thank you so much. That was really inspiring. While we're sitting down, I know that the introductions have been done, but I still believe, ladies and gentlemen, it is proper. They say behind every thriving community, innovation, ecosystem, there are people who are committed to building that future. We are privileged to welcome the leader of the Ogun State Technology, Innovation, Entrepreneurship, and Digital Transformation side. You are welcome together with your team. It's a pleasure. Please let's put our hands together for them. It's really indeed an honor. We are referring to Chief Durosumi A.E. MSc, MBA, MNCS. All right, and a host of other very big accolades. So you're welcome. Thank you so much. Next, we are going deeper. We're diving deeper. Like I told you all, we are cruising. Today is an epoch event, and without wasting much time, we are going next to the keynote, the next speaker. We are going to be talking about, he's going to be talking to us about time as a valuable resource. Time is a valuable resource indeed, but every day we see countless productive hours that are being wasted. Our next speaker will help us to understand the true cost of waiting, not just financially, but socially and economically. Please, let's put our hands together as we welcome Mr. Yomi Adoluto as he takes the next session. Please, let's put our hands together for him. You're welcome, sir.
Good morning, everyone. I'm so happy to be here today to join this great movement. And I want to welcome all our guests and everyone here for taking out time today to be here. Sorry, I don't know what's happening to the screen. The color is quite different from what I have on my. So permit me for that. I don't know what happened. It's looking so beautiful here, but the color is so different. Okay, so today I'm going to be talking about the cost of waiting. As a background, Victor and I were in UI together many years ago, and incidentally, we also worked together at BIB Software. That was in also many years ago. Interestingly, we have something in common: the passion to look at a problem and come up with solution. And I'm so glad that that passion has been there since, and that's what gave birth to Turnify today. So I'm so happy to be here, and I'm going to be talking to us in a few minutes about the cost of waiting. Now, I'm going to be talking I'm going to wear my other professional hats. So I'm going to be talking like an expert in this area. My name is Sabayomi Adelowoton, and I'm an executive master black belt in what we call Lean Six Sigma. Lean and Six Sigma are two complementary process improvement methodology. Lean focus is about identifying and eliminating what we call process waste. And Six Sigma's focus is about variance reduction. What that means is that if you say your process is going to take 30 minutes to do something, it should be 30 minutes for everybody. Not that some people will experience 1 hour and some people will experience 2 hours. So that variation costs money. So that has been my expertise for many years, and I will be wearing that cap to talk to us today about the cost of waiting. Now, I don't know if you have ever been to the hospital before, just like Victor was saying during his presentation. Even in private hospitals, you notice that when you go to the hospital, there is always a queue. People are always waiting. And what we have found out is that you are likely going to wait for 2 hours for a 20-minute care. Now, we might say that, oh, it's necessary because a lot of people are going to the hospital and they need to do this. But it's not supposed to be so, and we can do something about that. I'm fortunate to have seen a system where that works before. So I did a little, spend a little time to do some research, get some data about what is actually happening, and I put all the sources there. At the clinic, it was estimated that we spent about 113 minutes waiting for a 24 minutes doctor consultation. Then for some pharmacy, it was noticed that about 167 minutes at Loot, for example, that's their outpatient pharmacy. And out of that 167 minutes, about just 17% of it was actually spent dispensing the medication. The remaining time, spent on waiting. And then we have the lab test results. Sometimes you do a test now, you have to wait for a long time. And we are so used to that waiting that we don't even know anything is wrong or what's wrong with it. You do a simple test, they say the result will come out in 3 days. That 3 days, some patients don't have 3 days to wait. And if you are going to speed it up, maybe you need to go to a private lab, and you can imagine what the cost will be. And that does not even eliminate the delay. So we are dealing with a real problem. Now, like I said, talking from my perspective as a professional in process improvement, there is something that we call the 8 waste. In every processes, you can see this, you can eliminate this. And what we normally say is in line with what Victor said earlier, that, you see, eliminating waste is not the problem. Seeing the waste is the problem. When you don't see that there is a waste going on anywhere, you will not have any opportunity, you will not even think of doing something about it. But when you learn how to see waste, then you can start doing something about waste. So we say, when you start our lean journey, we say you start learning how to see. And I'll quickly tell us how to see that. There is what we call the 8 wastes here. The defect is a waste. Anything that does not meet the specification of the specifier is a defect. For example, now, if I say I want a phone, if you give me a phone with a broken screen, that's a defect. So that's a waste because I'll probably return it. Then, another form of defect is what we call overproduction. Giving more than what a customer is willing to pay for is a waste. Or maybe in the morning, you are going to present a 5 minute presentation to your boss, and you prepared a 150 PowerPoint slides for a 5 minute presentation. That is a waste. So overproduction is a classical process waste. Then we have what we are talking about today, waiting. Every form of waiting is a waste. You know, if you are not aware of this, you are used to thinking that waiting is normal. I'm at the back. We are finished. Maybe some of you work in an office. Where is this assignment? Say, I've finished it. I've sent it to my manager, or I've sent it to HR, or I've sent it to production, and we are just waiting. That waiting is a waste. You know. For example, you will notice that in some instances, your manager or your MD or a leader needs to give a response. We want to purchase this thing, we need a response. Or how long will it take to take a response? Maybe less than 1 minute. But the email has been staying in the inbox for 3 days. Why? Because someone said, I've sent the email to her and I'm just waiting for the response. If you have understand that that is a waste, you could just have pick up the phone, make a phone call, and eliminate the 3 days of waiting for a 1 minute action. Now, other types are there, but I'll just dwell on waiting today. So we have all those 8 process waste. Waiting is one of the common ones. We are used to it, we are so familiar to it, and it's taking value from so many things that we do. We call it cost of poor quality. What you are losing because you don't have top-notch quality in your process. So today, waiting it's not just delay in time. It means if, for example, you are paying a staff or paying your staff to deliver a service within 8 hours, and you expect them to serve 50 patients, for example, in 8 hours, let me just say that, or 500 patients in 8 hours, or 500 customers in 8 hours. Anytime you delay, it means you will not be able to serve up to 500 customers within that 8 hours window. So what it means is that instead of you spending maybe 1,000 naira to serve one customer, you are spending 10,000 naira to serve one customer. So at the end, you find out that you are working hard, you are tired, but at the end, there will be no profit. Because why this is so dangerous is that you don't capture this waste in your accounting books. So it is called aging factory. Many companies or many organizations, you can just say a lot of things by just measuring this time and putting measures in place to eliminate those waiting time. Now, let me bring it down to what we are talking about today. Generally, from the research, we found out that if you go to a public ward, you are going to spend between 2 to 4 times the normal time there than what you are going to spend in private hospital or private ward. But all of them have this skill. They all have this waiting time. So from the data source that we look at, we found out that in hospitals like in Rivers State, they said like the waiting time for outpatient is about 45 minutes. When you begin to get to, that's for private, but for public, that's about 133 minutes to wait. When you move to southwest, it's jump up to like 137 minutes. You move to Sokoto, for example, that's about 168 minutes. But in Lagos, it's about 274 minutes waiting time. You know, waiting time. This means, assuming a doctor supposed to spend, let me say, maybe spend 24 minutes with a patient. So it means he will not be able to attend to as many patients as he will be able to, normally will be able to do because of this wait. So it's serious and it has a serious impact. Now, the same thing with the pharmacy also. An average of 167 minutes to wait for public pharmacy, out of which only 17 minutes out of it is actually spent on dispensing the drugs. So 68% of that goes straight to total waste. Now, why do we even need to look at it? If you also notice that, if you look at our population in Nigeria, let's go with about 220 million people in Nigeria, and we have about 55,000 doctors. You know, so that means each doctor is expected to serve about 8,000 people. You know, and if you look at the records, about 16,000 plus doctors have left the country in the last 5 years. You know, so meaning that we don't even have enough medical practitioners to attend to us, given our population. And with this, we still now have to wait to access this care. So what I'm saying here is that this is a huge problem. It costs money, it costs time. I know when you get medical care in time, it can reduce, it can determine whether you are going to live or you are going to die if you have a case. So this is a very serious issue. Now let's bring it down. If we go with the cost of 70,000 naira minimum wage in Nigeria, I don't know if all the states have implemented that. That's what we have on paper. So what it means is that an average person earning minimum wage earn about 398 naira per hour. So if he needs to wait for 3 hours to access medical care, it means he's spending 1,200 naira, losing 1,200 naira for that waiting period. But you know what we found out in Nigeria? In other industry, in other environment, you have health insurance, you have health insurance. So you don't pay most medical bills out of pocket. But in Nigeria, 75% of medical care is paid out of pocket. That's if not 100%. Some people have what do we call these people? HMO. But those HMOs are what they do in most parts are symbolic. They don't, once something begins to pass one thing, you start hearing different stories, you know. So what I say is that Nigerians spend their money to access the care. And the research that was done for the general low and medium income earner countries found out that this cost of waiting, this cost of delaying is about $15.8 billion per year. Now, this is not the Nigeria alone data. This is low and medium income earner statistics. What we are losing, the research did not break down what goes into Nigeria, but to let you see that this is a big and big problem, you know. So when we talk about waiting, we are not just talking about, okay, we are losing time, you know, we are losing much more than time. We are losing much more than time. What kill waiting, what it does beyond the time that we are losing time is that it drives people away from accessing the care. You say, I am going to the hospital, I'm going to spend 4 hours, 5 hours there. Then people don't go. They don't want to go because they don't want to go through the stress. And by the time they will be going, they will not be the one making the choice to go again. Somebody will have to carry them to go because they can't go again. So those are the challenges that this thing is. So if people know that accessing this medical care is challenging and they are not able to go, it means situation, diseases, cases that will have been eliminated, earlier will get complicated. And by the time they are eventually able to appear in the hospital, it might be too late. So this is bringing it home to see what we are actually losing. It's not just that people are waiting this time, they are losing time. People are also abandoning these facilities because of this waiting. Okay. Now, why is this a good problem to solve? In some hospitals, because the cases are not, we have 1 or 2 hospitals or facilities in the country where this system, where they work, but they are very, 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 they are just between 15 to 30%, and they are not for mass market. They are very sophisticated medical facility centers that they are way, 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 way above what many people will afford. So what that means is, sorry, I need to charge this. My battery is going down for the laptop. I don't know, I have a charger there in the bag. The bag is over there. Sorry about that. It's under that. Sorry about that, my battery is not, I thought it was charged. So what it means is that 93.7% of all these facilities still depends on manual production, paper waiting, paper not managing the queue at all. And that's the important why this solution that we're talking about today is a very important one. I've experienced this before. I wanted to get a driver's license, and I was able to queue from my home using a similar system. So you put in all your details and everything, and you give it, okay, you're going to come on this day. That is a separate scheduling. After giving you that day, on the day that you're going to go, you can go to the timeline and queue. So if, for example, by the time I get there, just like Victor said, there are 20 people already on the queue. So it means that between 7 a.m. and 8 a.m., if it is 10 minutes or so, it has already been scheduled. So those times are not available again. I can now say, okay, I want to come in the afternoon and put in my thing, and then even put me on the queue. But I know that I'm only going to be, I'll be attended to between 10:30 and 10:50. So I don't have to leave my house and go. In fact, they will tell you the rule is that I arrive 5 minutes before your time. So you are not even allowed to come 1 hour and say I'm waiting for my time. No, they don't have that space for you. So you see them attending to a lot of people, and you get to the place is not rowdy because everybody is coming on their queue. And if you miss your time, you are going to go back to the end of the queue. So imagine That's one of the things that this system will do for us. You can queue. You can queue at home and then go to the hospital. So if you know you are going to the hospital on this day, you can book the time, you can queue, and it will be feasible to everybody. You see, just like Victor said, you see a dashboard showing who is currently being attended to now. You know, you see who is currently being attended, so you know that, oh, in the next few minutes it's going to be my turn. And if there is a delay, everybody will know that there is a delay. Maybe there's an emergency or something. So at least it is feasible. And what that does is that, first, if you need to go to the office and you need to take 30 minutes or 1 hour to go to the clinic, you can go to the office, do something, and then go. And so, since it's about 24 minutes or 30 minutes that the doctor will eventually attend to you, we can eliminate that 2 hours wait for everybody. In a situation where time can be converted to productivity, that means if you are able to save 2 hours per visit, per patient, we can have a lot more, much more hours to contribute to someone. Even if you are only using that time to rest, it means you will even live longer because you are sleeping better, you know. So we have a lot to gain by looking at this. So what are we supposed to do? What are we supposed to do? For us from different as the states, we have oh, okay. Oh, wow. Sorry. Okay. So we need to look at where we are having many places we are using paper for queue. Is our responsibility here to try to introduce this system to them so that we can at least see what is possible. We also have such opportunity in Lagos, and many of us here, there are so many things we can do about this. Every community development association, every PHS or general hospital member experience this queue weekly. So we can localize it. We can, when we understand the problem that we are trying to solve and what we are losing because of that, then we know that it's a serious problem that requires serious attention. This system has helped to close the gap of first feasibility. Like I said, to eliminate something, you need to see it first. You cannot solve a problem that you have not been able to see. So feasibility, you know, from my experience in industries, in improving processes, we found out that when you have conversation around numbers, you can change anything. By saying, okay, yesterday we did 10, today we did 6. What happened? Without even using any tool, just having number to start that conversation that yesterday we were here, today we are here. What happened? People say, oh, we're supposed to do this, we're supposed to do this. Okay, let's do it. And you find out that the next day, the number will be up. But if you don't know, you'll not be able to do something about it. So this system brings feasibility to the problem, you know. Then accountability. This gives, every stage of the patient journey, you can know that, okay, he spent 10 minutes to register, spend 2 hours to wait, spend 24 minutes or to receive consultation or attention from the personnel. So that accountability makes us say, oh, we are the one wasting most time. So you can do something about it. And also, it's also bring momentum. Once something is feasible and people are responsible for it, you can deliberately decide to change it. You know, so that's one of the things that this solution is helping us to solve. And all of us in the room, we have responsibilities. To stress test it, play with it, come up with new things to make it better. For our students, use your fresh eyes to bring in new thoughts that can make it better. And for our CDA members, take this message to everywhere, to the people that needs to hear it, so that at the end, we can have a beautiful solution that is solving real life problem. Thank you. Thank you. Thank you. So,
Please let's put our hands together again for Mr. Yomi for that very, very inspiring presentation. We are moving deeper. Say we are moving deeper. Yes, indeed. At the beginning of the program, our host, Dr. Victor, he talked to us about what the problem is, the cost of waiting. And he let us know that this is actually a cultural problem as well. And the way to solve cultural problems is education. And as we saw, we were just educated now that the problem also has a Naira sign to it. Once again, I want to thank Mr. Victor for really elaborating on the fact that this problem is costing us, not just in time, but in money, and ultimately, as we go to the next speaker now, who is a professional, a health professional, a practicing professional that actually understands where this thing bites the most. We're going to be calling up this person to talk to us from the health perspective, the healthcare perspective, healthcare delivery perspective, how this problem, if not solved, is impacting the lives of people. Please, I'd like to welcome Dr. Nike Odeole. Did I get that right? Dr. Mrs. Nike Odeole, to talk to us about the waiting room experience and challenges of manual patients. Please, let's put our hands together as we welcome her. Okay. Please keep clapping as you come forward. Thank you.
I'm so pleased to be here, and I want to congratulate my brother for this work. Though I've not understood how it's actually going to help us, but I think I'll be better educated here. My job is of manual patient flow. Period of time. My brother is sure that, honestly, I want to first of all say that all over the world, let me say, agent that was managed here, traveled to UK last year, also to be reviewed. And on getting to UK, the person actually had no traffic accident and fracture was, he had the operation and he was supposed to be serious with the master students to continue the studies and they are booking an appointment to speak to the orthopedic surgeon. They go and see maybe a family physician, not to talk of booking an appointment to see the orthopedic surgeon. So it's all over. It's not only in Nigeria. The problem is all over. Now coming down home, coming to the hospital, we have a population of 200 million, 220 million, whatsoever. We don't have 55,000 doctors in Nigeria. By now, I think we have less than 30,000. And divide that by the population. The World Health Organization should be like a doctor to, like, we have some states, I will just localize, there are some states in which the whole local governments and states might have just like 2 or 3. I'm not talking of specialists, I'm talking of, general physician. Talking about specialists, in a situation in which you have specialists, cardiologists, neurosurgeon, and things like that. To be satisfied. And that's why, for most of the children, when they just, we get this and this and that, they are already like it. And the parents go, they didn't even allow me to talk or to, say all my complaints because they start writing medication because that doctor may be thinking I have 10 others, 20 others waiting for me. And I must tell them before I leave. So before you say that community, they are already making prescription. So if you want proper, consultation, most especially in the consultant clinics, you need more time to get to the root of the problem because the patient may have gone to several other places and they have done so many other things that could be that have even actually complicated the situation. But you as a consultant, you as a senior doctor, you actually want to get to the root of the problem before you say, okay, this is where the problem is coming from. But I also need, to make further diagnosis by doing this and this and this first. Because they need your consumption room. So you will find out that you may be spending more time than is expected, depending on the case of an individual. And getting to pharmacy, in a public hospital, you are running, surgical clinic is running, orthopedics is running, ophthalmology is running, general patient, internal medicine, and all of them is not only, we are talking about manual patient flow. In many general hospitals in Lagos now, we are using the EMR, we are using the computer, we are using the electronic medical device. And, as you are writing, as you are consulting, you are sending your investigation to the laboratory, you are sending the medication to the pharmacy. And getting to the pharmacy, you also have like 20 patients waiting at the same time to pick their medication. And if you start like 6 drugs, they need to take this from this maybe table or cupboard, they need to take another one from there, and they keep going from one end to the other. You need to take like 6 different medications for a particular patient, and you must be accurate. You must not give. We've seen situations in which people will go to apologies for my Igbo brother to the Igbo shop, and they will give less time, which is a treatment for an antihypertensive that is called losartan. So if one patient comes and say, what drugs, what medication, bring out your medication, let's see, and you now see lesothan instead of losartan. Then, why are you taking this one? I said, that is what was prescribed for me. No, this wasn't supposed to be prescribed for me. But on getting there, the Igbo boy does not know the difference between losartan, which is an antihypertensive, and losartan, which is an antihypertensive, and lesothan, which is a treatment drug. And they keep using it. And we have complications as a result of that. So the pharmacy must take their time, or the pharmacy must take their time to make sure that they get the right drug and also educate the patient. This one you must take before food. This one you must take 30 minutes after food. This one and this one, there will be drug interaction when you are taking it. So don't take them together. And go to the laboratory. There are some investigations, that you need to take the samples together and group them. There are machines that, for them to run, you need like 30 samples, you need like 50 samples for them to run, except you want to weigh the reagents. And the reagents are out of this place. They are so expensive that you cannot afford, you cannot open a bottle. It's just like vaccines. If you want to give children, immunization, there are some vaccines that you must open just 30 minutes. Within 30 minutes, you must give all the children. So when the mothers go to immunization centers, family health centers, and they want to vaccinate the children, and maybe the health workers, the nurses, whoever, gather the mothers together and start clapping, giving them health talks and things like that. It is because they are waiting for their profit that, okay, we have this vaccine, there are 10 doses. There are 20 doses, and we don't want to waste it because every dose is accounted for. So you don't want to waste it. You want, okay, at least a few children, so that if you waste 2 doses, it's better than allowing, you have only 10 children and there are 20 doses in each buyer. And you are going to waste 10 doses, and you are going to report back to the local government and to NPI, National Program on Immunization. Why did you waste 10 doses of BCG when you don't even have enough? So they will ask you to wait so that you gather the number of children that you want to vaccinate together, so that this wasting that you are talking about, not the wasting of that, even the wasting of the medication. So they allow the children, the mothers to come together, educate them, even give them some other, education about it, why the children will have diarrhea, how you can take care of diarrhea, if there's high fever, what you should do, so that it will not result in seizure or convulsion before you bring the child to the hospital. So it is not actually in the real sense of it. You are not wasting time. You are doing something productive. So, like I said, in the laboratory, you may need to actually wait for all the samples. You want to gather them together before you run them, because even the machine will not even run if you don't have that enough samples. Or even if you are going to run, you'll be wasting thousands of millions of naira of reagents if you are running on that. You are supposed to put 50 samples in the machine and you are putting 20 and you open the reagent and the reagent is going to get wasted. So, these are the salient reasons why people will wait. It's not just like, the taking of the time actually to go to the hospital, it depends on what you are going to do there. And, unfortunately, like I said, like my brother has rightly said, the number of physicians on ground now is grossly, I can tell you, very, very grossly inadequate for the number of patients. I just told you that the doctor may have taken a call. You know, I've been in the hospital in the last 24 hours, taking a call throughout the night. You can't predict how many patients that even come during your call hour, and the person may not have slept. And you need to continue the consultation in the morning or even go to the theater with the surgeon. And you want, and you want that person to still be fresh and, at times you are consulting right. Some people are dosing in the consulting room because of stress. So I feel, the waiting, most especially, in the hospital and as per healthcare worker, it's not as if it's deliberate to waste people's time. But it's the protocol. Like I've told us, it's not as if you just get to the hospital and you jump to the doctor's consultation. There are some other people, other desks that you need to follow. Where do I write your consultation? And there is slogan. Anything is done that is not documented is assumed not to be done. And the reason why you have to make your proper documentation is, you may not be the next doctor that a patient that is seeing you today will see next week. So whatever is done today, if it is not properly documented, there has to follow up. And whatever the person that has been exposed to in the time past, or whatever you are doing, you need to write it down so that whoever is saying the next time can adequately review, or maybe whatever investigation and you want to review, either yourself, even yourself. You are saying like 20-50% in a day. How do you remember each and every person? It is when the case note comes, or when you open your camera, it's Mr. Alabi, okay, these are your complaints, and these are what my, query diagnosis is, or was as at the last consultation, and these are the investigation to actually prove or to confirm my diagnosis. So you need to have a proper documentation. And in these days of mitigation, it's only a documentation of what you have done or what you did not do that you even intended to do, that the patient might not agree with you at times. Or you may even document and the patient may say, I don't have to. You need to be, admitted, you need to give you this or that. I cannot wait because I don't have the money. Somebody is coming in with a case of with a situation in which the blood sugar is hitting the roof. I say, we need to bring this down. And when I go to Kuma, I want to go to Kuma, let me go to Kuma. I don't have this. I cannot go into the hospital. I cannot be attended because I cannot afford it. And the next time they are bringing that patient into Kuma, it is not in the right. It is in fact, maybe you may be able to say it is hemorrhagic from there. You need a quick neurosurgeon to work on hemorrhagic stroke, and where will you get them? Maybe we have only one until we meet, and maybe in last week, maybe we have only one. And more general hospitals do not even have any. So you will find that somebody was talking, or this has been plumbed, they get to the hospital, it's CBA or a stroke, and they say they cannot admit the person. They cannot admit the person because they don't have the facility to admit the person. The neurosurgeon to do, or even the first thing is to do the brain CT. The brain CT is not in the general hospitals because the machine runs into millions. So you have to refer the patient to maybe a diagnostic center outside, And some of them is, this is general hospital, this is how much you are going to pay. Because in general hospital, ordinary syringe you need to buy. Hello, that is what they are facing. There are many accident victims that will come that we have to put money into our pocket and get the necessary things to give to the patient. How many times are you to refill your emergency kit? You put the free gas, then you put the carnival, you put the giving test and everything. Within the twinkling of an eye, it's gone. The one that is provided by the government. And this is somebody that maybe they may even be relation and they will tell you that I'm just here the person on the road, you don't know the person. Even the ones that are ready to bring, they will say, okay, buy this, buy that. In the next 2 hours for a patient that doesn't have 5 minutes, if you don't get available. So the problem is huge. For patients that even walk into the hospital, by yourself, and you need to wait for all these processes. I'm sorry to say, we should even come to everyone. There are so many that we brought even by relatives. We're not even talking of how would I call them, neighbors or people that will even pick accident victims or people that will slum on the road. And they will come and dump them on us. And some people they don't have any margin. They are not even attending to them. You are only 2 doctors at the emergency. There are 10 emergency situations in your front. I've been in a situation very long time ago. I was a young doctor about 25 years ago. On that short Mainland Bridge, these are the boys. They load themselves inside a bus. I don't know what they were doing. And the bus was someone on that short Mainland Bridge. And of course, very fatal accident and things like that. And they found themselves, I think that bus was just starting there. And that was 2003. Passengers brought them. By the time they brought them, some had laceration on the head, some hands were broken, and things like that. And myself, my nurse, maybe the nurse attendant was there. And of course, their organ attacked before they brought him to the hospital. So the one that had laceration on the head, I was trying to treat them. And I think when they got the news at the other end of Obalende, some of them carried themselves and they came. And the first thing they saw was the one that was lying that, of course, in triage, when you have multiple accidents, the ones that are very, very bad that are likely to die, or the one that is dead, that's -1. The one that at least is surviving, keep living, that's the one that can truly try to do something more. So they came and they did not, they did it. So when we saw the crowd, we had to lock the emergency room. So some of them came through the window and said, this is this man, okay, they are even tying the head of that one. And you can think that it's part of the plan. It's not something that is deliberate to punish the patient. No. Even, we are trying to do something that will come faster, that patient that comes, that can pay more. We try to speak faster. But that also deprives the normal patient, the other ones that cannot pay enough, because it's the same hand. You have your normal training, 50 people are waiting. Somebody is calling for fast track, they are paying 20,000 instead of 5,000 consultation. You are saying that person, because they are paying less of 15,000, want to take on your price because they feel that they are paying so much. But the people who are waiting, because it is only that is going to come out to them. Even in a situation in which you have so much time, every other person is occupied doing one thing or the other. Remember, there are some that are already on admission that you need to review on a daily basis. In fact, you might review a patient in the morning and you feel everything is okay. In another 1 hour, you're noticing that calling you, oh, doctor, that person, the BP is weak, the BP is down, this one is weak, this one is down. You need to maybe you give the clinic and run to the ward to go and do some other disease. So how would the people in the general outpatient or in your outpatient, how do they go with that situation? It's not easy. Thank you, sir.
Please let's put our hands together once more time for Dr. Miguel Julie. Thank you so much, man. That was really enlightening. I don't know how many of you, while she was talking, for me, I was just seeing that this is the reason for Turnify. As she was speaking, I just kept saying, thank God that we have a solution like Turnify. Because many of the pain points, because he showed us real time from an insider perspective, the pain points that Turnify seeks to address. We are going to change gears for now, and we're moving into another section, very equally important. Technology communities are engines for innovation. All right, so there are places where experts, learners come together so as to connect. You see, engineers, developers connect with ideas, people, creators, businesses, entrepreneurs, to provide the kind of solution that we are experiencing today, that we have come here to launch. I would like to, without wasting further time, I'd like to say that it's my pleasure to invite the president of the Mowe Tech Community, Chief Duro Simi. Did I get that right? Duro Simi, AAMSN, MBA, to come on to lead us in the next session, where we will be talking about the launch inauguration of the Mowe Tech Community. Welcome, sir. Thank you so much.
Thank you. Good afternoon, everyone. Though I'm not yet a chief, but maybe Mowe has given me that title. I will accept it. Let me stand on the already established protocol so that we can make use of the same IP address that has been established in the beginning of this program. Let me quickly mention the members of my team that are here, because Mowe Tech Community, like I said, is a community of all startups and innovation in Ogun State. And I'm not the only one. We have almost 1,000 members. About some month ago, Minister was with us in Abeokuta. That is Minister of Communication, Innovation and Data Economy, Dr. Bosunti Dani. We started this communication, myself and Dr. Victor, January 2025. He saw some of the activities Mowe Tech Community has been doing, and that's why he felt that there's need for us to be here this afternoon, and I'm happy to be here. The ex-practitioners have spoken. We need Turnify. Let me quickly mention this. Aside the cases of emergency, what about quite a number of people that ignorance, they are at home, they don't even know how to have access to medical doctors. My Ogad has given lecture in the area of those figures that was released by him. I do have attention for those in the rural areas. And Turnify will do well, because there's a report from NCC last year that Nigeria is number 7th in terms of country where they are using mobile phone. We are number 11th in terms of country where they are using internet. And now the number of doctors are reducing. There are some cases that you don't even need to see doctor physically, and that's why Turnify can come in. Now we have people making some mobile phones. The mamas, our galagbas, they are at home in the village. There's internet there, according to report with NCC. They can do a video call. They can reach out to the medical doctors. So Turnify is the way to go. And I'm happy to be here because it's a solution coming under Mowe Tech Community. This is the first of its kind. We did something of surveillance about reporting disease case. The Commissioner for Health was with us, Dr. Toby Koka, about some weeks ago. It's also a product coming from Mowe Tech Community. But this is indeed what we need for the hospital. And that's why I'm here with my head of the team. She's also head of the media team. She's also a newscaster. Adewumi Opeyemi, she's here. Our correspondent from Punch, Guardian, they are joining a particular ex-handle communication ongoing. They are promised to write about this report. Of course, we start seeing this in the media by Monday. I also have Sobur. Sobur Raji is here with us. He's the head of secretariat and community manager who handle what the executive are doing. While I was here, the board chairman is also chatting with me. Somebody who was when is the GMD Champs PLC, somebody who started the idea of BVN, Engineer Femi Williams. Champs started BVN in Nigeria some years back before it's been embraced by governments. So we have the cluster of different professionals in the Mowe Tech community. I also have the Oladoyin Ben, who we call him AI experts, and he's also a community manager. Their work is just to maintain active communication and feedback within the community. And we also have Faith, who is also in front of. We have they are different fields. Ope is into UI UX. Sobur is a backend developer, and Ben is AI expert. And Faith here is also a front developer. Mowe Tech community, like the MC has said, is a community of all startups and innovations. We are here to promote all startups. And that's why when Dr. Ogusoya said there's need for us to come and do something here in Mowe, Ibafo, Magboro axis, we are handed over this place to him. We were in Ijebu some months ago. We cannot just be in Abeokuta and be doing things. In fact, you are even closer to Lagos. We have discussed with the minister and the so-called Iyabo Eji and the likes that things are also happening in Ogun State. It's not only Lagos and Abuja. We are doing something fantastic. This is one of the products that we need to showcase. But I've realized one thing, that we don't promote what we are doing in the States. And that's why they felt that those things are happening only in the Lagos. I've attended 2010, 2011, 2012. I attended nearly all the IT events in Lagos. I was telling my colleagues, Civic Center, Renaissance, Lagoon Restaurant, all these events, Oracle Day, a lot of launching, when Jonathan Obaro is speaking, this and that. But a lot of things are also happening in Ogun State. Do you know that Ogun State is the only state where students from primary, secondary school, secondary school, have what is called learner's ID. They can check their results. Students from Ogun Water side, they can check their results. But because we are not promoting some of those things, and that's why many people are not aware of those, activities. And that's why we must celebrate. Dr. Victor, at a point, you need to have a breakout session where you create a hashtag for this. Let all of us in the audience, 5-minute session. We must write something about Turnify today. Everybody, create a hashtag, 5 minutes, let us write about it. That's how we become. You don't need to go and pay influencer. We can influence this. Media people are here. We run 4 radio programs in Ogun State. There was a time they asked me to come and speak on Women FM here, 7 years ago, Magboro here. I think that was the first time I said, okay, something is also happening. We speak in all the radio stations in Abeokuta, in Ogun State, in Lagos. Let's make noise about this, because this can actually solve a lot of problems. Nigeria is giving us figure that we have 55,000 doctors. I'm sure if we check very well, we have less than 20,000 or 30,000 thereabouts. You understand? Media, please don't carry that one. I'm sure, I'm telling you this, I know the scarcity of consultants. I know of one endocrinologist in Abeokuta. He has to travel everywhere. Dr. Adesina, he has to go everywhere, to even Yaba in Lagos, Yaba, Ikeja, Ota, you understand? And these are cases, he has to manage a lot of diabetics patients, different type of diabetics. They are having events coming up in OPN by August. So I work with some of these doctors. I can understand the challenges that they are facing. And that's why we must digitalize our system. Turnify is the way to go. So let me quickly speak about what the Tech Community has been doing. 2018, we did a convergence of all IT professionals in the state. The event was held at OPL. We brought academians, practitioners, different fields, those in the entertainment industry. We brought movie industry. Today, Kelani, yes, a lot of them, we brought them together because we are talking about developing the IT ecosystem. Everybody use technology to play now. Everybody, whether you like it or not. It's not whether you study computer science or you study this. That's not what we are saying. I study computer engineering and computer science. So let's leave that one. Everybody is using technology to drive what they are doing. And that's why we are bringing everyone to, come together. After the event, 2018, there's a fallout that there is a need. Communique was released that we should set up what is called a community base for the youth. And that's what gave back to Ogo Tech Community 2022. It was launched at the Tech Up. In audience that day, we have the SA on IT to Ogo State Government, Mr. Dayo Abiodun, and some other key IT professionals, former Commissioner for Finance in Ogo State, Mr. Kennedy Shogule. I've mentioned Mr. Femi Williams. We have the former president of Nigerian Computer Society, Professor Adesina Osano, because we need those in the academic industry. Everybody's talking about Silicon Valley. Why are they growing? In that area, they have highest number of institutions. We can't develop without students, and that's why we must bridge that gap. So we need the academia in developing this ecosystem. That's why we are bringing everybody on board. We have the director of the IC, Mr. Deputy. So the OTC is to, create this platform. We have different clusters. Ben is the head of the cluster. What are you doing? We have OTC media. Those in the media, whether you're in Punch, Guardian, what you do, we go to Iweroni. I know some we know Iweroni in Abeokuta here. You are using Grammarly writing good English. We also want to show you some AI tools, how you can report some of those events immediately. So we have cluster for media, back-end developers, front-end developers, AI enthusiasts, UI UX, different clusters, about 18. I think Ben can speak to that, and that's all about what we have been doing. We have embedded system engineers, agri-tech innovators, ed-tech innovators, and when you talk about ed-tech innovators, among the members is former NMA chairman in Ogun State, Dr. Kunle Ashimi, is also in that platform, and these are some of the things they are promoting. Because there's nothing you can do, shortage of doctor. You can't stop doctor. Federal government started talking about they want to put a ban, they want to put embargo. The embargo will still work. Doctor can escape through Ghana routes. Our border is porous. Don't let us be deceiving ourselves. Doctors can escape through Ghana, they can escape through Benin and leave the country. If the pay, if what we are giving them is too low, what we are spending on the health sector is too low. So, but in solving our problem, we are not here to talk about what government is doing. In solving individual problem, let's open up to Turnify. Turnify provide doctors for us services, bridging that gap. I think that should be the focus. Bridging that gap, you need to see endocrinologists, you need to see consultant pediatrician, you need to see a consultant urologist, you need to see consultant gynecologist, a specialist in a particular area. So Turnify bridging that gap, and that's why we are very much happy to be part of this event. I mentioned about this IDS Master that was launched March this year. The commissioner was with us. The impact of this cluster has brought about great information in the state with the launch of IDS Master in March this year, a community-sensitive surveillance application to report suspected cases of infectious disease. That's another angle where we are looking at. We read about MPOS in country like DRC. When I was at DRC for 2 years ago, MPOS broke out. We couldn't go out again. We went to go and train some, because my domain is in the area of cybersecurity. Went to go and train some, bank officials. But when the disease broke out, that's why when we begin to hear also about Lassa fever in a particular state, the issue is, do we get those information real time? And that's the essence of this solution, where people can be aware. We don't want to listen to, remember what happened during Ebola, when some set of students, I don't want to mention their school, when they came up that what you can do to cure Ebola is by taking salts. A lot of people lose their life. Do you understand? We are telling people, you see, major challenge. I haven't spent about 15 years on radio discussing tech, whether in Yoruba or in English. We have realized that our level of digital literacy is too wide. That's why NITDA, National Information Technology Development Agency, did a report that it is by 2030, Nigeria will achieve 95% digital literate. Till tomorrow, people don't know that this information is legitimate. During total lockdown, we are talking medical today. During total lockdown, there's an announcement that we should stick to NDPC, Nigerian Center for Disease Control, NCDC. Do you understand? And NCDC is also getting reports from John Hopkins and the lies in US. But despite that, people were on message in some problem. They stick to that information. They are not going to NCDC to get latest reports. That is what is called digital literacy. People are not getting, how do you know that this information is legitimate? And that's why we are championing, we are working on how people with the digital literacy. The people at digital literacy, they will use Turnify. They will not just stick to TikTok and be watching only Pella. Do you understand what I'm saying? They will understand the basic things. I've been supervising JAMB exam in the last 7 years. When we monitor, I'm part of the team that accredit JAMB CBT Center. We do that every December. We were in this area some years ago. When we monitor the JAMB exam, we realize quite a number of candidates that cannot navigate with computer. They fail that exam because they are not used to CBT exam. They are already shaking when they are coming to the examination hall. Because there's a camera in front of the examination hall. Digital literacy. The government is talking about introducing this exam will be this. So we must be part of it and emphasize to people, let us be digital literate. If you are digital literate, we understand that there is need for us to use what is called Turnify, and that will really help. Today, exactly what Turnify seeks to do, we sincerely commend the founders, Dr. Busoya, for this. They have demonstrated something we encourage every innovator in Ogun State must do. Let's clap for them now. We are not afraid of NEPA. 2009, when they were playing Nigeria 99 World Cup, that youth, they took lights in Ibadan. So it's not an issue. To every young innovator listening today, remember this: you do not have to build the next global social media platform to change the world. Solve the problem around you, solve challenges in healthcare, solve problem in agriculture, solve problem in education, solve transportation, solve governance. And one of the problems that we are talking about, people should solve around us, is this Turnify. And I also want to bring one of the message from the former president, late president. We should start making use of our own indigenous solution. If somebody is launching Turnify from Canada today, UK, you see a lot of people embracing the idea. And that was why when Flutterwave want to launch, it started from US, GB Agbola. It started over there. Do you understand? So, but we are not going to allow the founder of Turnify to get discouraged. As we are leaving this place, we send some of this story to media. We'll continue to mention it. This is the first of its kind in Mowe Tech Community. So we are going to continue to promote it. So thank you. So that's what we do in Mowe Tech Community. Now to the issue of launching, because I don't want to bore you with a lot of news, a lot of lectures. I'm happy Dr. Busoya is here. We are charging to bring all the tech practitioners together. We don't just want politicize what the politicians are doing, that the tech is happening only in Abeokuta when you're talking about Ogun State. Tech is here. We don't just want you to leave Mowe for artists. We are happy. If somebody has invited me to Lagos today, I will not go. Because the attention, it's all about Lagos. When I was speaking with the founder of Piggy Best last year, when he was in Abeokuta, I said, you started in Covenant University. Now you are claiming your throwback. You're only claiming Lagos. What happened to Ogun State? So I'm happy this is happening here. And that's why we must continue to promote this product. So the team of the tech startup that are here with us, I don't know whether we have the owners of innovation hubs here. Can we just signify? I think this is a stand for the hub owners. So I'm happy to see you. I want you to work alongside with Dr. Gusoya. We have a lot of opportunities. We promote your content. Are you looking for professionals? We link it up. About 3 weeks ago, one of the members of the Greater Mowe Tech Community that also Japa is a data analyst. We are not stopping people from Japa. But when you Japa, remember us. Bring the idea. You understand? Bring the idea. The ongoing World Cup, we saw from the same family, somebody play for another country. It happened in this World Cup. So the ball is in your court if you are leaving the country, and they decide to go back to DRC, Senegal, Ethiopia. But what we started, we want to continue to provide a platform for people. When you leave the country, come back. Even if you are not coming back, please let there be synergy. That's what we did. When he came back, he was planning to, I want to host the team of OTC. I said, no, don't just host us. What are you going to buy for us? Pepper soup, wine and dine at OOPL and leave. No, that will not only solve the aim of the OTC. We took him to Crescent University, to the department or to the faculty of computing. More than 1,000 students listen to what data analysis has gone to this level now. There's a new product from Microsoft called Microsoft Fabrics. That was what he taught about 1,000 students. We've seen quite a number of them showing interest in that program. We cannot do without data analysis. We cannot do without it. Data is key. Remember the keynote speaker when he was giving us data. If you don't know data, you can't solve problem. You cannot solve any problem. And that's why people are saying government has not been able to solve the problem of power. Did government know the power we are consuming only in these streets? When you know the power we are consuming in these streets, that's when you know the entire Magboro. You know the entire Ogun State. You know the entire Abeokuta. That's why we cannot say this is what we are generating. But we did not know it. So that's why the issue of data is key. So he was able to introduce students to that Microsoft Fabric. A lot of students are showing interest in that because it created a platform for them to continue to have, handshake, internet experience. We left Crescent University to Chrisland University the following day. Go and give back. When you do that, you spend 1 week in Nigeria. When you do that, then you can now host us. We can wine and dine. But those knowledge you have to impart, and that's what we are, clamoring for. So OTC is a platform to, bring you together. Are you having challenge in the area of media? What can we do for you? One of the best OAPs among us, you must have heard about Emmanuel Oke, is the one who hosts this present Lishabi. We brought a lot of people together. We have medical doctors, we have back-end developers, many of them. What do you need? And that's what OTC is ready to provide for you. We have a platform like this. We will come. We want to promote your products because that is the goal. We want a good product, a good solution from Ogun, and that is one of the aim of Ogun Tech Community. So this afternoon we'll be going back. We have another event by 4 p.m. in Abeokuta. So we have to also rush back, Abeokuta. So as a form of inauguration, let the hub owners stand up here, please. Hub owners, we want to inaugurate you to be a member of OTC. I'm giving you a direct membership. The hub owners, yes, doctor. Yes, this is my. What did you say, ma'am? Yes. So I'm happy you are all here this afternoon. Dr. Ogusoya is going to be the community manager, the central head, whatever things you want to do. You can go ahead and open accounts for this area. We'll give you our CAC. We'll write a letter to bank for you to control your affairs. You just give us your reports. Maybe you want to have your dinner or any engagement will come. Whatever things you want to do, do it. We are operating like Facebook. Nobody is stopping Facebook to do anything. There's a platform called Hodo today. They use it for CRM and a lot of tools. You can tweet Hodo for many things. Nobody is stopping you. We don't need one. When you call me this morning, you chat me. I should send you account number to you want to send us. I said, don't worry. We went as far back as Bells, Yewa to develop. You are doing something good. You are doing something good. Because if you have launched this product in Canada, people will say, this is Canada, this thing. People will start saying, we are happy that you launched this. And this product will even grow more than the existing one. Yes. Yes. We'll continue to promote that. That's why I'm saying that you and I can make it happen. Take a picture here, put it on your status, write about it. Let people hear about Turnify. We are going to tag Minister. We challenged Minister when he came the last time, and he did apologize, Dr. Bosu Tijani, that he never knew something good like this is happening in Ogun State. And this is also part of our report. We are expecting him very soon. The day we are expecting him, we'll notify you so that you can bring all members of Mowe, Ibafo, Mandoro to Abeokuta. You know, we will come back and we showcase this is the only solution we have that solve the problem of health in Ogun State. So that's why we will continue to mention Turnify as a product from Ogun Tech Community. So once again, the team here, I know he has created the WhatsApp platform. Let's have your name. We'll send you the form so that we can send you membership number and your certificate. It is free for everyone. Nobody's charging any platform. We want to continue to promote services for students around this area, please. Just last week, students of Ogitech, they called me. They want to do excursion. I said, go to New Horizon. You see, we are all in the same shoe. Don't look at anybody as a rival. You may do something in transportation. You may solve the problem of logistics. We still need a lot of indigenous solution. What we are spending on foreign solution, just think of it. The only thing that make you open an app in Nigeria is only bank app. Have you ever thought of it? And that's why we are not getting money. Today, you have used WhatsApp. This morning, you have used your LinkedIn. This morning, you have used your Facebook. Before we are using those products, we are making money for Zugabank. I was checking the data. As of last week, we have 2.8 billion active users on Facebook. 2.8 billion active users. Do you understand? Can we promote our own? Can we promote our own? We are doing well. We have a lot of talent here. The guy I mentioned with you, he worked with the NDPR. If you talk about NDPC Nigeria, Nigeria Data Protection Commission, there in UK is called NDPR. That's the government he work with. In fact, when he came, his IP address could not open because he's here outside UK. Even using VPN is not working. He has to return back. So even Nigeria is working in that critical stage in UK. So what's stopping us? Talents are here. So let us promote our own. We'll continue to speak about this. Do you understand? Turnify. So once again, I want to welcome you to Ogun Tech Community. You are part of us now. We are going to give this report back to the board. The engineer Femi Williams he started the idea after he left chance. You may have read about the first African indigenous video conferencing platform. You may not know about it. I know you know Zoom, you know Google Meet. Connect. They call it Connect. You call it Connect. You understand? So let us continue to promote our own. You understand? There is no way you will see solution for hospital in UK that will have our own indigenous language. Everybody is talking about OPE today because OPE did a lot of mapping. They met with MSME. What do you call your own? They are not using all those big grammars. So there's no way you can talk about health solution that can be like Turnify. He is here, he's practicing here, and check with the doctors here. Doctor that is practicing, look at what doctor mentioned the other time. You can't find that in UK, where they are treating patients and the Agbero is threatening you. So they have considered that in the development of this solution. It is our own. It can solve this problem. So let us continue to embrace the indigenous solution. Thank you very much. I think we have a good picture before we leave, please. Even with the hub owners, then probably if you can pardon us, we can have a good picture, then we take our leave, please.
So we can do it here, right? Okay, yes, let's do it. Once again, let's put hands together for the president of the Mowe Tech Community. Thank you so much for this. Congratulations. Congratulations, congratulations to the Greater Mowe Tech Community. It's been brought to my notice that a number of tech hubs are joined us together, have joined us as during the course of the presentation of the Mowe Tech Community president. So the tech communities are going to be calling you. Of course, we have already mentioned Upskill Tech Hub, we have Soft Lead Tech Hub, we have Pronovic Tech Hub, and we have 3D Media and Print. Please, if you are here, can you just wave to us? You're welcome. Put your hands together for yourself for coming. All right. We are getting ready to enter the main event, the meat of the program, Turnify. You know, while the respected doctor was talking and explaining to us, giving us an insight into the healthcare delivery system, I couldn't help but I kept thinking about some of the issues that she raised. And our able and respected president also highlighted the fact that we have an issue of dwindling or continuously reducing number of tech experts. We have doctors that are leaving the country. They are health professionals that are leaving the country. And for me, it strengthened the need for technology innovations because you have a problem where you have undersupply. The demand is so much, but the professionals to match or meet that demand is continuously reducing. I mean, for a country of over 200 and something million people and less than 30,000 doctors, it's only in this part of the world that that kind of thing will be normalized. So for me, I kept thinking that this is a case for organization. Just picture a situation where, as we have that door, that's the exit door, and you have a huge population of people who are trying to exit that door. Don't you think it is better to have an organized queue exiting that door where people are lined up and they are going out one after the other? But when you have a situation where a crowd in here is now trying to force their way, everybody trying to go out of that door at the same time, we are going to have a serious problem. Am I right? So that is the reason why we need solutions like Turnify. Because Turnify does not solve the problem of healthcare provision. That is not the problem Turnify is trying to solve. So it's not trying to say, oh, we should not do something because the problem is there are not enough doctors. Turnify is trying to solve the problem of uncertainty. Right? There are people who are waiting. They are waiting in line. But if you take away the uncertainty, if you organize the process, if you turn it into a system, then it takes out the uncertainty. I'm coming to the hospital, I can know before reaching the hospital that I have like 30 minutes, 15 minutes, 20 minutes, 5 minutes to spend. I'm not worried about if I come to the hospital, then I don't have an idea. I can go and then maybe I might not even see a doctor. So Turnify creates a situation where people can know from going to the hospital that okay, I have like so amount of minutes to wait. Because once I go there, I have a ticket, and the ticket is real. I can see that the doctor is available, and this amount of time is what I need to wait. So if I need to dash somewhere to do something else, I'm not worried that by the time I come back, my time is past, somebody else has taken up my situation. So it helps to remove uncertainty. It takes away the anxiety. It organizes the process. That is from the end of the receiver. I believe that even from the end of the people who are providing the service, they can know beforehand that these are the amount of patients that are available well ahead of time for me to attend to. So it opens up the system, it makes it so clear and easy. And a lot of other services can be plugged into this organization. We are getting ready now to enter the session where we need to get to see Turnify display. All right? Are we ready? Are we ready? No. The response I'm getting is like, well, let's start with sir. Let's not show them this thing. Let's go. All right, are we ready? Yes, because this is the reason we came here. This is the reason we came here, and I'm going to call on Dr. Victor to come up right now and then launch us into what we have been here, come here to see. Thank you. Let's put our hands together. Welcome to our stage.
Thank you. How do you need this? Okay, please open some of the. Okay, the battery is low. Okay, this has to be on the charger. Okay, I think I think it is, man. Wait a minute, check. Let's check it. No, it's not. It's not. Okay. Well, thank you very much, and it's good to be here again. But before I proceed with the official unveiling of Turnify, I want us to do something. I want everybody to join me in appreciating all the doctors around the world. Please, let's stand up and give them, because they are heroes. They are heroes. Let's appreciate all the doctors providing health care services around the world, because this is very important. We are not talking about software. If it is software, it's disconnected. We are talking about a movement that involves everybody, including the doctors. Because, please be seated, we can continue now, because that really got me thinking. We look at issue from the patient perspective, but how about doctor's perspective as well? But the good thing with Turnify is that it's a bridge in between. It's not just going to be helping the patient, but also providing the needed help. Because imagine somebody who has not slept for this, and you are now having angry, anxious patient as well. So it's like adding, petrol to fire. But now, if we have a system that provides visibility, that provides calmness, that patients are more supportive, they are now, because they know what is going on. When we talk about these 3 hours, or 4 hours waiting, it's not saying if there is visibility, if there is something to help patients to make better use of the time. If I know that, okay, I will be spending 5 hours in the hospital, so be it. But what can I do in between? Can I spend part of this time to go and do something else? It may even be as simple as going to Abegi, somewhere, under the shade, to go and catch fresh air. So that is what we are talking here. In fact, Turnify does not even replace any existing infrastructure like healthcare or EMR system that is already in place. It's a system that complements. It's a system that complements and empowers healthcare provider to do their job better. So I'm going to be starting by, okay, we already have this solution has different areas, but because of our time, I will just go straight into now unveiling the display over there. Because the display, we have something called the display, and we have something I'll be talking about here, which represent different sections and different kind of interactions. Like we have seen here, there are 3 partitions on this screen. We have one partition which we will be bringing up very shortly. That partition will have the kind of interaction that will happen when patient, maybe is probably, because I mentioned something that the software itself will not do the job, but processes, people, and all of that has to be part of it as well. So we will be working with the hospitals in order to know where within their flow to sit Turnify. So what we have here is where they will be issued tickets, because in the scheme of things, the way they do things right now, there is somebody issuing a ticket either on paper, the kind Dr. Mrs. mentioned earlier on, where people, and in fact, we are even already, Turnify is already solving one of the problems you mentioned, because in a situation whereby somebody can claim, just go and write, because there's no signature, there's no timestamp. So anybody can write that, oh, I'm number 2. How do you now determine which one is the original ticket number 2? But with Turnify, that is already been taken care of. So on the display over there, this is what we see at the hospitals, where patients can check. So if we have a new ticket coming in, which I will do right now, so as somebody is coming into the hospital, we can I'll be using this phone and this printer. So we so I have the Turnify app here. So from this app, like I said earlier on, the app will be running somewhere in the flow, and each hospital will have their own configuration, or let's say every clinic. So with all the things that they are, when the patient can come for, it can be because this one drug refill, maybe it's pharmacy, there or something else. If a patient is coming for gynecology, laboratory tests, and all of that. So at the point of the check-in, or where patients are being tried, I don't know, but it could be either of those two places. That is where, in addition to the current process, a ticket will be issued and be given to the patient. So assuming a patient is coming for medical examination now, so over here, I'm going to be generating a ticket to that effect. Okay, so I got here. Okay, yes. So I'm going to do that again. Okay. So on the tickets that we have printed here, this is what we are saying that the patient can receive as part of the check-in process. This ticket has different things, including the QR code. We have the ticket number. The position for this ticket now is position 2, and the estimated waiting time is 6 minutes. In fact, this estimated waiting time, we won't just make it up, because we have to talk with the doctors on average, because like what doctor said earlier on, for a particular patient, it can take much longer. Maybe it's 30 minutes, but for whatever reason, it's their discretion. They will use their discretion to spend however long it will take. But what we are doing is to work with them to make the whole process more transparent, so that patient gets the information as it occurs. So that's what we are saying here. So the ticket I just created now is already showing over on the screen, M002. So on this screen now, if I get M002, I know the next in line is M001. Even without knowing this number, let's say we have something without this, I know I'm number 2 on the screen. From this screen, I'm on number 2, because on my line, the next group that will be called is M001. Now, if I get, because this is just the first one we are checking, we are checking in, it may even be a situation whereby we have had like 50 tickets, and the next, the one on the screen is M050, and mine is M057. But by just looking at the next in line, I can have an idea of how long it, how many patients are still going to be attended to before me. So now on this other screen here, we also have something that can be used maybe by another, maybe we are looking at the situation whereby as the patients are coming, they receive this ticket. This is what we are getting the ticket and joining the queue. Then there are two other ways of joining the queue, and I will talk about each one of them briefly. The second will be for those who are tech savvy, and like the OTC president said earlier on, a lot of population are using smartphone in Nigeria now. So that won't be so much of a problem. We are looking at a situation whereby healthcare provider may as well have a QR code. We have this QR code, and I want everybody to join us in this exercise. You will see a QR code on the table. Please, you can scan the QR code. Environment, the environment we are demoing today. So I'm going NQ will be seen reflecting real time on the
two queues. There's one to join the queue and there's one that so there's different from it. Which one is to join the queue? So
okay. So I understand there are two QR codes. One is to join the queue, the other is for appointment. The one I'm talking about now is to join the queue, the QR code to join the queue. And if it can be shared, the link can be sent to those online. If they want to join from different locations, we can also allow that. If you can post the QR code online, please do so. Yeah, right. Okay. From this screen, as people are joining online, we should be seeing real-time updates on the screen as well. Right now, we can see the queue from here. There are one person waiting for gynecology, then there are three for medical examination. Can we please join? Let's make this interactive so that we can see this thing real time. Okay, I think somebody just joined the queue. Yeah, okay. We have 4 for medical now. So as we can see, as people are joining the queue, because like I said, we have different screens. This is the screen for the head desk or front desk officer. The front desk officer is seeing the queue as people are joining either by using the ticket, by generating from this ticket, or people who are joining online from the platform, from wherever we are joining, because a lot of people might have joined this queue from different locations now. But what I'm saying is that we see this real time, we see the update real time. Now, assuming I now want to call, maybe it is called for a particular ticket number. Let's say I go to this medical examination and I want to call, the first thing I will do as an FDS staff is to make announcements, to announce that ticket number. When we announce, we'll check that to show whether or not that patient is available. Okay. What's wrong with the problem? Okay. So we will here the ticket number being got, and the person with the ticket can now make their way to the service area. And we are looking at making this available in different, at least in local language. If it is the southwest, we at least have it also announced in Yoruba, and in the east, it will be announced in the indigenous Igbo language, and in the north, with at least 3 official language, and we can work with the locals to make other languages available as well. So this is what we are talking about. You can call, because let's look at the situation whereby somebody has stepped out. When they make the announcement and the person is not there, they doesn't stop them from moving to the next person that is available, and the process will continue. And whenever the person with the ticket comes back, it can be some, because his number will still be showing on the screen. And we also give the healthcare workers to use their discretion. If that they want to
proceed to the service area.
okay. So what we have seen here now, 2 things. I've checked, the help desk officer has checked just checking a ticket. We envision a situation whereby doctors themselves will see the visibility. In addition to the current EMR system that they have, they should also have an interface where they can see people who are still waiting or people who are joining the queue, so that if they want to put a stop to it, they would, like we see here, this doctor, this is the same for the doctor, and this doctor knows that there are 7 people waiting, even though we have more than 7 tickets from the total. But because this doctor is providing certain care, that 7 people have joined, so it is already aware that there are 7 people already waiting for the service. And we also have, because I'm just going straight into the solution itself, but we will work with them to know the capacity, like how many patients can they possibly see within a day. And when that number is reached, nobody will be able to join. As a matter of fact, they can even put a time window through which people can join, because the whole idea is for them to be able to determine the number that they want to, the number that they will be attending to on a particular day earlier enough, so that they can plan as accordingly. So this doctor, once they are done attending to the patient, they can now check out the patient. This is what we were talking about regarding the doctor spending time. As a person, if I'm monitoring my queue from remote location or from the waiting area, I know that this guy M001, my number is M002, and maybe I'm expecting this person to come out in 10 minutes. But if he has not come out and nobody is going in, there is no need for me to be hungry, because I will have that visibility. Even if somebody is going in, as long as it's not M003, I'm fine. You understand? Because we believe that good system and feasibility will encourage good behavior. And so is bad system. Because if people have an idea that they are being cheated, like maybe I've been waiting for some time and somebody who is coming after me is just going inside, that will be hungry. And that's the thing, that's the problem that Turnify is addressing from the patient point of view, as well as helping the healthcare provider to remove this unnecessary tension, agitation from anxious patients. So this whole thing is something that will involve we have interaction from the patient, interaction from the healthcare provider, and so on and so forth. Now, somebody with is anybody looking at ticket number 00 and M005 is Who is the person with ticket number M005? Okay, M005, thank you. So can you please show us your screen when I check in new now? Okay, so because this is important, okay. All right, okay, sorry, I'm going to do it differently. Let's do something together again. I want to generate a new ticket M006. From this ticket now, I have my position on the queue is number 5 and 15 minutes waiting. So what I want to do is to now show how patients can subscribe to this ticket on their phone rather than having this your paper base to have the digital equivalent of this ticket. I'm going to use. All we need to do is just to scan this QR code. There's the QR code scanner on this phone. Okay. Do we have a QR code scanner on this phone? I think this will scan it. No. No. Come on. Do we have a QR code scanner on the phone?
No,
What about this?
no.
Huh?
No, sir.
That's not it. Okay. So when we are waiting for okay. So what I want to show is how patients can monitor their queue remotely. Because for those who have actually scanned the QR code, as I'm checking in a patient, they will have received real-time notification to that effect. Somebody who probably was like number 5 on the queue before, as soon as I check in a patient, and this will be happening in different locations. The person may be 1 kilometer, 2 kilometers, or even still at home. But the fact that there is this communication real-time update is creating some kind of, in fact, the congestion, because one of the things that we also need to talk about that we have not even mentioned today is the congestion of that waiting area. Because if there is an outbreak of a fever or a particular infectious, disease and all of that, having patients to wait not in the waiting area will go a long way in controlling the outbreak of disease as well. So that is an area, and even the indoor environmental condition, because some of the government office hospital, I'm sorry to say this, but it is a reality, are not well ventilated, and having too many people crowded in that small space is also a problem. Okay, it may not be like it would be let's go out, but right now, if I go out, I'm just say maybe on the corridor, I don't know, maybe I will be the one to be called next. But if I have something that alerts me, that let me know that okay, it will soon get to my turn. Oh, I still have 3 people before me on my plan. It helps because it is when we start to use this that we see how it will make life better even for the healthcare providers. So, I mean, okay. So let's check. I'm going to just okay. Somebody with that ticket number 5, if you can just stand up and show us your screen, but at least people will see it. So I'm going to say ticket. I'm checking the ticket number 2.
Ticket number M
is there a way these ticket numbers can be probably merged with customers' details? Okay, so for example, where I work, right, we call it a code. It's a CPL number that we call it. So we just type it up, according to our company's name. So, but it's a customer ID that when you purchase something, they tend to merge those maybe customer code with your details, bank details, and stuff like that. So when when you see the code, they know the customer automatically. When you punch it into the system, it brings out customer details, and it's just that same customer details that they use in pay instead of using the customer's name directly. So it's just more like a code. So do you have something like that?
Okay. Yeah, in fact, what I talked about just now can as well be used for what you have just described. In the hospital, we have like patient number. In the hospital, I mean, that's what they use to uniquely identify every patient. In the universities, matric number, we do exactly that. In your environment, customer code is, we will do the same thing. So if we are setting up your environment and want to capture that details from the user, it's going to be customer code. So as they are joining the queue, they will be prompted to also enter the customer code. So whoever is attending to them, and that customer code will even be printed, whatever it is. Right now, it is not here because, like I said, it's optional. But when we turn that on for any particular site, it will also be printed on the ticket itself. And whatever you have called it, that's what will be printed on the ticket. In some university environment, it will be matric number. Hospital, it will be patient file number or customer code in your case. Okay, yes.
Good afternoon. My name is Rashid Busari. So I want to find out this solution. Is it a queue management system or a schedule management system? Then another question is,